Hi, I'm Vana. I am a hypnotherapist and I have an interest in psychological tools and techniques. Today, I will discuss a case study titled Cognitive Behavioral Hypnotherapy Augmented with Virtual Reality Exposure in Flight Phobia. I am especially interested in some of the techniques that help the participant with her flight phobia. A little bit about the participant in the case study. Her name is Maria, and she had the phobia for about 5 years. Because of that, she suffered from emotional, psychological, and behavioral symptoms. For example, even at the thought of flying, Maria would experience intense fear, headaches, hyperventilation, trembling, and feelings of being out of control. Other than the phobia, Maria was also diagnosed with significant levels of anxiety, a medium level of depression, insomnia, and irritability. After the 6 sessions of therapy, her problems disappeared. Now, let's see how it all started. Maria grew up in Romania and had a normal childhood, but her mother was rather anxious and overprotective. However, nothing specific from her childhood was identified as a direct link to her phobia. As an adult, Maria really wanted to visit her brother in Canada, but the news of a plane crash became the one traumatic event that caused the phobia. At the time of the traumatic news, she had already booked her flight tickets to Canada, but ended up cancelling the trip because of the phobia. However, at the end of the therapy, she was able to fly to Canada without a problem. Now I will discuss the key techniques that help Maria. Before I start, I will list them. They are self-hypnosis technique, ABC model, direct hypnotic suggestion, metaphor, and virtual reality exposure therapy. Maria was taught self-hypnosis and she was instructed to practice it before bedtime, which she did. Within a week, Maria reported that self-hypnosis helped her overcome her insomnia, and she also stopped taking sleeping medication. I will now explain the self-hypnosis technique that helped Maria. Self-hypnosis included a breathing exercise and a therapeutic intervention. She was taught to repeat the breathing pattern of breathing into the count of 4, holding to the count of 4, and breathing out to the count of 4. Maria was also instructed to use a therapeutic intervention called the blackboard method. She was to imagine writing on a blackboard the negative words and especially the ones associated with a phobia, such as insomnia, irritability, nervousness, and fear of flying. She was then asked to erase them with a sponge and relax. After that, she was asked to write positive words on that blackboard, such as health, self-control, tolerance, and peaceful sleep. Finally, under each positive word, she was to write, "I will succeed, I will succeed." Now, let's move on and talk about the ABC model. The ABC model was proposed by the psychologist Dr. Albert Ellis, who also developed the rational emotive behavior therapy. The ABC model was used as a framework to help Maria reduce her perception of fear. Normally, people believe that external events or situations create their behavior and reactions. However, according to the ABC model, it is not the external events, but our own beliefs and thoughts that trigger our feelings and behavior. It is good to remember that no one and nothing can make us feel anything without our consent. I'm trying here to paraphrase Eleanor Roosevelt's famous quote, "No one can make you feel inferior without your consent." Similarly, Shakespeare in Hamlet said, "There is nothing either good or bad, but thinking makes it so." This type of philosophy is not new, but it stems from the ancients, such as the Greek Stoic philosopher Epictetus. Back to the ABC model. This model challenges negative thinking and behaviors. The A stands for activating event. B are the beliefs and thoughts related to that event, or the meaning we give it. And C are the consequences, such as negative feelings and dysfunctional behaviors. In a nutshell, ABC means that the activating event triggers beliefs that cause emotional consequences. In the case of Maria, the activating event is the thought of flying. Her belief was that planes are dangerous, they crash, and the consequences were fear and avoidance behaviors. Maria rated her fear a 10 on a scale from 0, representing lack of fear, to 10, excessive fear. But with the help of the ABC model, her beliefs about her fear were challenged and the rate dropped from 10 down to 6. To challenge her beliefs, she was asked to rate other terrible things, such as the death of a loved one, the illness of a loved one, sickness, and the flight phobia. From this perspective of comparison, her phobia did not seem as terrible. Therefore, her belief about her phobia of flying started to shift. In addition to the cognitive ABC model, hypnotherapy techniques were applied. Direct hypnotic suggestion was used to change Maria's stressful reactions to situations concerning phobia of flying, including seeing a plane on TV, seeing a plane ticket, and boarding a plane. Direct suggestions work by telling a client how to respond in a specific situation. For example, telling a client to imagine that as they are boarding the plane, they feel calm and confident. Maria's fear decreased for all the stressful situations related to her phobia after direct suggestion hypnosis. Also, a metaphor was used in hypnosis. Maria was asked to imagine moving her hand towards the plane. And as she was doing that, she was to imagine the size of the plane getting smaller and smaller until he was as small as a toy. And then seeing the small plane as a friend. Maria reported that after this session, she perceived the plane as something safe. She said that the plane had become her friend. Now, I will discuss the virtual reality exposure therapy. 2 sessions of virtual reality exposure therapy were chosen instead of the classical exposure that would involve actual trips to the airport. The virtual reality exposure therapy used software that simulated a 3D world of the plane. Maria did very well and managed to calm herself as she was looking out of the window in the virtual environment. After the 6th session, Maria was able to control her fear and managed to fly to Canada. On her return trip, she reported that she enjoyed the flying experience, especially the view from the plane's window. Now, I will talk about my thoughts concerning the case study. I will discuss my views on the number of sessions, the cause of the phobia, the ABC model, self-hypnosis, and the use of virtual reality software. Overall, the techniques were successful, and I also use similar techniques in my hypnotherapy sessions. It took 6 sessions over the period of 6 weeks to get rid of a 5-year phobia, including other problems such as insomnia and irritability, and this is a great outcome. I do use a slightly different approach, and I normally get positive outcomes with clients within 1 session, and on rare occasions clients may need more than 1 session. So I do think that 6 weekly sessions for a phobia cure are possibly more than necessary, but on the other hand, it is not excessive. It is not as if she had years of therapy. Maria's memories, including childhood memories, were discussed in therapy. However, I would have used hypnotic regression with the client's consent to identify the events that may have contributed to the cause of the phobia. Also, I would have worked on the client's memories to ensure they no longer cause distress. It is worth mentioning that nowadays hypnotic regression can be done very gently and safely without causing negative emotions or abreactions. The ABC model is great, and I personally use something similar to challenge my own limiting beliefs. But I use my own private journal for that kind of analysis. However, even though the ABC model is very useful in therapy, my own experience with clients tells me that it is not necessary in a hypnotherapy program. I do find that hypnotherapy on its own is very powerful and fast in creating desirable changes. The blackboard method is a great technique for self-hypnosis and may suit some people who suffer from insomnia. I find that self-hypnosis is not essential to a hypnotherapy session for phobias. However, it is something nice to teach people because they can learn how to access a calm state at will. Keeping this in mind though, most people do not like to spend a lot of time practicing self-hypnosis. But there are ways of practicing self-hypnosis that can take as little as a few seconds. We've seen that direct suggestion hypnosis and hypnotic metaphors were used with Maria. Both hypnotic approaches are very powerful, and I myself use them with clients for the purpose of changing unwanted emotional and behavioral reactions such as fear, anger, addictions, and pain. Now, about the virtual reality software. I would not use virtual reality because I do not think it is necessary. In a sense, your mind and thinking is your virtual reality. However, I would ask a client at the end of the session how they feel towards the fear. I could also show pictures of planes to make sure that the hypnotherapy worked. I normally instruct clients to fly within a week of the hypnotherapy session because once they test their phobia by actually flying, then they are truly convinced that they no longer have the phobia. So that is all from me now. Please like and subscribe and put any thoughts or questions in the comments section below. Thank you for watching. Bye for now.